So welcome to the 13th Annual Air Quality and Health Conference here in Vancouver, here at the Sheraton Vancouver Wall Center, in fact. I'm sitting here with Dr. Bruce Lanphear from my alma mater, Simon Fraser University. There we go. He's also the clinical specialist at BC Children's Hospital. So he's here to give us a talk on a very interesting title. I want to make sure I get this right here. The Tortuous Road to Prevention. And are we there yet? So, Dr. Lanphear, let's get right into it.
You have to get the subtitle right. It's like a kid asking, "Are we there yet?"
Are we there yet? This is going to be really interesting. We'll try to condense this into a bit of a nutshell. So, do we really need more studies on air pollution and health? What's your thoughts on that?
Well, in some sense, we know enough to act, and I think that's probably the key. The evidence is very definitive around linking air pollution with cardiovascular disease mortality and with lung cancer, and that should be enough. We know what to do. We know that even at the lowest levels, there appears to be an increased risk.
Yes.
So we know enough to act, and we should put a lot of effort into this.
Yes.
We should put as much effort into this as we're putting into understanding genetics or treatment of any kind, because this is really the ultimate solution, prevention. That's what we should be focused on.
Absolutely, yeah.
So yes, we know enough. Having said that, the other part of this question is, do we need more research? Or should we just stop investing in research around air pollution?
Right.
And of course, we need more research.
Yeah.
Not all of us need to be doing more research. Some of us need to put our efforts into preventing exposure. Others of us, like me, need to put efforts into try to translating that so people understand it.
Yeah.
Because unless we get the public invested in this, we're going to continue to invest all our money in genetics.
And
we're not going to prevent the disease in the first place. So why else? Well, one of the things, there's some new research linking air pollution with ADHD, with cognitive deficits in children, even perhaps with autism. Okay. Why is that important? Well, one of the things that is going to drive a lot of these cost-benefit analyses is if you have an impact on brain development that has lifelong implications, that would reduce lifetime earnings or increase the cost for treatment like autism, that's huge. And it's going to at least equal the cost of air pollution related to premature death and lung cancer. So that's really important. It may also be true that the brain is more sensitive than the lungs. We don't know that yet, but if that's true, then the way we should be regulating toxins like air pollution should be using the most sensitive organ.
Absolutely. Yeah, it's interesting you mentioned all those things. I mean, do you feel like all these studies and all these things that we now know about the effects that it's having on our body is influencing policy at all? Is that a way that people should get to know more about these things?
It is, but it takes a long time. I mean, one of the slides that I pulled out was from 1880, where they were already starting to quantify the impact of the London fog on deaths.
Okay.
1880.
Yeah.
So we've known this for a long time. So what have we done for the last 150 years, 130 years?
Yeah.
We've improved our ability to quantify exposure and to quantify the impact on morbidity and the specific types of morbidity and mortality. Now that's important, but the point is that we've known this for a long time and we still continue to pollute.
Absolutely,
So it takes a long time.
Yeah. Now, is it really important for us to know all the ways that air pollution affects us?
Well, I think it is. Again, not before we take action. We know enough to take action. But for example, right now we have an epidemic of dementia. The rates are increasing dramatically. Now, part of that's because we have an aging population.
Of course.
But it may also be because of certain types of exposure, whether it's lead or whether it's air pollution. And so to the extent that we are better able to understand that, we can have an impact on those conditions, although to some extent, Alzheimer's may be due to exposures that happened 20 or 30 years ago. So in some cases, we may be too late, but we may be able to help out other countries that are industrializing and have much higher rates of pollution.
Yeah, big time. Now, obviously with air pollution, it's out there, it exists. Is there, in your opinion, sort of like a safe level of air pollution exposure, or is that not really a thing?
Well, the evidence would suggest that even at the very lowest levels, you see a very steep increase in premature death from heart disease and air pollution, and then it starts to flatten out or plateau.
Okay.
And that's important for a couple reasons. One is it suggests that previous studies underestimated the impact. That is, we know more about what's causing some of the diseases and deaths that kill us today than we did just yesterday because of those types of exposures. It's not like there's a threshold. The other part of the reason this is important is we treat these toxins as though there is a threshold. We regulate air pollution as though there's a safe level.
Of course, yeah.
But if there's not, we're failing to protect people. And if the exposures increase very steeply like that at the lowest levels of exposure, there's tremendous opportunity for prevention, more than we thought just a few years ago.
And that's an excellent thing, yeah.
Yes, it's a great opportunity.
Yeah, so I mean, what's next then? Or in your words, are we there yet?
Are we there yet? No. But we are closer.
Okay.
Just a little while longer.
Yeah. So
No, it's going to take a lot longer. And I think part of it, you can look at where we put our health dollars. In North America, we spend about 95% of our health dollars on treatment.
Yes.
On genetics. These are things that have already happened. People are already sick. Now, of course, we want to have a good medical system to take care of people when they're sick.
Right.
But what's happened is that we've evolved to the point of now we begin to understand the causes of chronic diseases. But we've got this medical industrial complex that continues to chew up all these resources, and we're not able to put anything but the little dregs that we get from those health dollars towards prevention. There's obstacles that are preventing us from moving towards prevention. For example, certain industries don't want us to increase the profile of certain kinds of toxins.
Yes.
There are other vested interests, like drug makers, that want to continue to focus on treating people as opposed to prevention. And then there's just sometimes blind ignorance. Not only that in a derogatory way, but people just don't know about it. And that's one of the reasons I've gotten so excited about how do you take some of this information and make it accessible to people.
Absolutely. Prevention's key, right?
It should be.
Prevention is key. So that's in our brief little time here. It's kind of all the time that we've got with Dr. Bruce Lanphear. So I want to thank you for that. Obviously in far more detail than we're able to have right here. He's going to give his talk shortly here, actually. And once he's done that, we're going to have his deck up on our website so you can explore that in a little more detail. So I really want to thank you for taking the time and doing this with us right now.
Thank you.
All right.